Hey, good morning, and welcome to Reality Bites with Dr. Kelly. I am Dr. Kelly. I am just gonna make sure this actually works today. All right, good morning, it's working. Okay, I'm just gonna play with my notes here, move it around so I can see people. Awesome, good morning, welcome to Reality Bites with Dr. Kelly. This podcast is meant to support male survivors of sexual abuse. It's not going to contain any graphic content today. It's not meant to replace treatment. It's just meant as a supplement to therapy. What I'm going to be talking about today is how to manage trauma triggers. And I did talk about this a couple podcasts ago. This is part 2. So, what I want to talk about today is sometimes people can be out and about, guys and gals, maybe you're out on a date with your spouse or something, and all of a sudden one of you finds yourself in a really foul mood and you don't know why. So this is what I want to talk about today, what could be happening for you in these instances. So maybe you're watching a movie or something, and like I said, you find yourself in a really foul mood and you don't know why. This could be because you got triggered. Men especially, ladies, men fail to recognize when they're being triggered. They fail to recognize what their triggers are. Sometimes we might need to help them. And guys, going to be really important for you to pay attention to this and, learn. Okay, so we get triggered, as I mentioned, we get triggered based on a response into one of our 5 senses. So something reminds us of a trauma we've experienced in the past and takes us back there. It's like we're reliving it. And so sometimes we know exactly what triggers us, sometimes we don't. So one thing that I teach my clients is that when we know, in those instances when we know what has triggered us, it's important to pay attention to those physiological responses that kind of come up in our body. So this is what I'm going to talk about today. So one thing I have my clients do is I give them a list of physiological responses and I give them some quiet time. I have them circle these physiological responses, any physiological responses that they know they experience when they're upset. I help them to do this because, again, sometimes we recognize, oh, maybe I drove by the place where my abuse happened, or maybe I saw my offender or something like that. Of course, we expect to have a physiological response in those moments. But other times, our triggers can be a little more subtle. We might have a reminder, but we don't really recognize that we've had that reminder. So we kind of want to come at it from a different angle. We want to be able to say, okay, I'm having the same bodily response that I have when I know I'm triggered, and then be able to kind of go backwards and look at it and say, okay, why am I having that bodily response? What got me this time? So I'm just going to walk you through a list of the triggers that, the bodily triggers, physiological responses that some people have. This might be a bit of a boring list to listen to, but there could be a few things in there that surprise you. So please just bear with me. Clients often report racing thoughts when they're triggered. Their brain's going everywhere. They're scatterbrained. They're thinking about 5 million different things. They can't concentrate. Maybe they start shaking or trembling, sweating. I have clients talk about yesterday. I was talking with a guy who said he gets tunnel vision. Other times, headaches. Sometimes you just have this desire to get out of wherever you're at. Maybe you might start feeling dizzy or lightheaded or numb or sort of not yourself. Maybe you feel like you can't be present in your time or your space wherever you're at. You could be like, I know I'm at this barbecue, but I don't really feel like I'm here. Maybe you don't recognize yourself in the mirror. You go in your bathroom, you try to ground yourself, and you're like, who are you? That was me in my entire 20s and early 30s. I didn't start to recognize myself in the mirror until I, learned some coping mechanisms, learned some grounding techniques, which I will teach you some at the end. Maybe you might be noticing, man, I can't make a decision to save my life. I have a girlfriend who told me she realized how bad her situation was one day when she was in an abusive relationship, and she said, I was sitting in my car trying to go for groceries, and in my head I'm thinking, oh my gosh, if I take the car, he might be mad because he needs it, and oh my gosh, if I take the truck, he might be mad because he needs it. She realized she couldn't make a decision, and she realized that was what helped her make the decision that she had to get out of there. Maybe you're feeling like you're suffocating or short of breath. Maybe your legs feel heavy. I've had clients mention that they'll get a facial twitch, or maybe nausea, or maybe you'll start clenching your jaw or your fists or even your toes. I have another client who said she curls her toes when she's upset. Maybe you get that lump in your throat, or maybe your face just gets flushed. This happens to me. Maybe you get all choked up and you can't talk, or maybe your tummy gets upset and you start to feel like you got to go to the bathroom, or you need to pee urgently, or you're getting diarrhea. Maybe you're holding your breath. For me, I get this tightness that kind of comes across my eyes. I know I'm triggered when I get, like, it's like a band of tightness that comes over my eyes. Maybe here's another one. Here's one that might surprise you. Sensitivity to light or sound. Ladies, if you have guys that are wanting to keep the lights dim all the time, sometimes it's because lights or sounds can be overwhelming to people who have PTSD. Maybe you develop a hypervigilance where, if a mouse farts down the street, you jump, right? So these are really common physiological reactions when we get triggered, when we are reminded of an event that was traumatizing to us. And they can be really upsetting, but they can also be a useful tool if we can learn to use them in a proper way. They can become like our smoke detectors. And it's really important to distinguish smoke, right? Like every time the smoke alarm goes off, which when I refer to that, it's those physiological responses. Not every time smoke alarms go off is it bad smoke. Sometimes there might be too much cheese on the pizza in the oven, or maybe your steak on the barbecue, the fat on it sizzling or something enough that I never heard of that happening, but it's an example that guys can relate to, right? Maybe if you're cooking indoors, your smoke detector will go off. This is common with me. Every time I make pizza, the smoke alarm goes off. So, but not every time my smoke alarm goes off is there a fire in my house, right? Sometimes it's just alerting me to another situation. So when you figure out that you're triggered, again, sometimes we know, sometimes it's really obvious, sometimes it's not so obvious. So we kind of want to be able to recognize it from another angle, from our bodily response. When we figure this out, when we do manage to figure out that we're triggered, it's going to be really important to investigate what's going on. I always tell my clients, like, go back in your mind's eye. Try to remember, what was the last thing I was doing before I got upset? Examine the situation. What was the possible trigger? Did I, watch a movie, for example, where, there was a scene that maybe was similar to something that I experienced in my past? Did I hear somebody say something? Words, for example, that were used during my own abuse, right? I had a client yesterday describing words that his offender used, and I said, well, those are really common words that a lot of people use in society all the time. Like, you got to do it this way, you'll get it right. I mean, my gosh, that's a phrase that, you could be talking with your friends and, you just wouldn't recognize that would be traumatizing unless you can understand trauma responses, right? So I teach all of my clients, examine the situation that you're in, take note of the physiological responses you're having, and also take note of those automatic thoughts that are popping into your mind. We can have some really distorted ways of thinking. We can start to think that we're unsafe just because we're having these bodily responses. So I get my clients to do their homework. Like, it's really important to be able to recognize, am I in an actual dangerous situation, or am I just being reminded of a situation that I've been in the past? It's really, really common when you've had a trauma to experience, physiological responses like what I described, emotional responses like anxiety, racing thoughts, even nightmares, that kind of thing. Those are really common responses to have after you've experienced what we would say, in therapy terms, we call it a big T trauma. Like maybe you've had a car accident or lost somebody, or male survivors, instances of abuse, women survivors too, of course. These are really common responses. In maybe little T traumas, like maybe a car accident where nobody was seriously injured or something like that. It's really common that people will just kind of have these responses, and then with time they'll heal, right? They'll stop having these responses. They'll stop having these reactions. And this can depend. Our response to the traumas that we experience have a lot to do with all the factors of the trauma itself. For example, what age was I when the trauma happened? Did I have coping mechanisms in place before my trauma happened? Did I have supports, emotional supports in place before my trauma happened? For example, as I described in an earlier podcast, a lot of times abuse begins at a very early age. This is way before boys and men have established responses, maybe even before they've developed their own ability to self-soothe. So that can play a huge impact on how a person responds, how a man responds when he's triggered, right? So did he have previously established coping mechanisms? Another thing, police officers, I work with a lot of police officers where they have to go from call to call to call. So they don't have time to recover in between attending to all these traumatic instances that are happening to other people. They're still witnessing them, even though they might not be happening to them themselves. They don't get that time to process. They don't get the proper supports. A lot of times they describe that they're alone. I had one client describe, he went to a terrible call at the hospital and he witnessed all the nurses and doctors, have a debrief after. He gets back outside and his boss is giving him heck. Where were you? Why did it take so long? We got calls backed up. So instead of having that comforting, supportive response, he gets pooped on by his boss and sent back to work. That really complicates how he's able to handle this, sort of big T trauma that happens, that he witnessed. Maybe he witnessed a child involved in a really traumatic incident. So in those moments, he feels alone, and feeling alone in a trauma is a really big, cause of PTSD. So I'm getting a little off track, right? But anyways, in normal processing, when people do have the proper supports, when they have had, previously established coping mechanisms, when they've developed that ability to self-soothe, which is something I talked about a couple weeks ago, they are better able to manage traumas. But if they haven't, they might not recover. And we, in trauma terms, if we continue to have these responses, for more than 60 days after the trauma occurs, this is when we start to call it PTSD. And this is when it can be really helpful to be aware of what I'm talking about today, where, sometimes we're aware of exactly what triggers us. Sometimes we might have to come at it from a different angle. We might need to recognize our bodily responses. And in these moments, it's really important that we develop sort of a dual awareness. So I might be triggered, but I don't know, but I do recognize, like for me, I said I get this band of tightness across my eyes. I might get an upset tummy. I might feel like I got to go to the bathroom. Okay, so I recognize that I'm being triggered. Now, what my job is, I need to look around. I need to do an assessment of my environment. Am I in actual danger? Right now, no. So I'm going to pay attention to what's going on inside my body, pay attention to what's going on outside, and differentiate between the two. So we have to develop a dual awareness. We call it extroceptive awareness. This is what am I perceiving right now outside in my outside environment based on my five senses. What am I hearing? What am I seeing? So when I look around and I see everything's calm, right now my dog's laying beside me snoring away. I don't know if you can hear him. So all is calm, but inside I'm a little bit nervous. I'm live on Facebook or whatever. Inside, interoceptive awareness, I'm aware of what's going on. Before I started this podcast, I had a little bit of a rumbly tummy because I was a bit nervous. But I tell myself, you know what? It's okay. I'm safe. So when we get triggered, we need to be able to recognize, that I am just triggered. There's not a smoke detector went off. There is an alarm going off inside of my body, but yet I look around and I see that I'm safe. So I need to remind myself that I am safe. So so what I teach my clients, that the way we manage being triggered, we have to investigate it. We have to pull apart the symptoms. So we have to pull apart, what was the situation that got me? This is how I teach my clients to manage being triggered. First, if possible, we want to be able to identify what got me triggered. I investigate it. And then I'm going to look at what is my thought process. What am I saying to myself? Am I telling myself I got to get the heck out of here? That's not helpful. And I will talk about like stinky thinking patterns that we all get caught up in another session. But just be aware that there are lots of stinky thinking patterns that we can get caught up in. We need to be able to think rationally. We need to be able to engage our five senses to calm that amygdala down so that the prefrontal cortex will come back online so we can think rationally. And then we also need to look at what's going on inside my body and attend to that separately. We deal with each of these situations separately. But what I'm trying to get across today is that it's really important to recognize that when we get triggered, when we get flooded, it's like there's this flood of emotions, flood of physiological responses that come in, they kind of wipe us out, they hijack us, and we need to take a timeout. This could be 5 minutes, 10 minutes, 30 minutes. Everybody's different. And I know sometimes, like with my police officer clients, that's not always possible. But if possible, we need to give ourselves a break. We need to lower the bar for ourselves. This is not the time to be problem solving or making decisions. We need to ground ourselves using our five senses because our amygdala is hijacked and our prefrontal cortex has gone offline. And so it's not the time this is one way men often respond, by going in the closet and getting that psychological 2x4 out and beating themselves. This is the least helpful thing that you can do for yourself in these instances. But this is what a lot of men do, and I don't want you doing this. So again, this is like in those instances when you might be out and about at a movie or something, and then all of a sudden you want to leave, you're in a grumpy mood, maybe you're out for dinner with your wife, something gets you and you don't really recognize why, but you like, I want to get out of here, this is dumb. You're all of a sudden criticizing the restaurant when really you were having a nice time until you got triggered. So women, sometimes you might have to be your guy's emotional coach. You might have to say, hey, did something happen here? Your mood changed suddenly. Do you need to ground yourself? Maybe you need to go take 5 minutes, take a time out. Do this process, examine what got you. What is your emotional response? What is your physiological response? What are you saying to yourself? And in those instances, be good to yourself. Don't say anything to yourself that you would not say to someone that you love. Don't say anything to yourself that you wouldn't say to your spouse that you love, or your child, or your best friend. Be good to yourself in those moments. And another thing that I teach my clients, so it might not be one particular coping mechanism that's going to make you feel grounded again. Sorry. Maybe you need a bunch of coping mechanisms. I know this is the case for me. When I get triggered, one thing doesn't work for me. I have to do a few things. I've taught in another show and another podcast, and one thing I teach my clients is to do this simple exercise. I call it 5, 4, 3, 2, 1. I didn't make it up, but you want to go through your five senses. So pick out 5 things in your environment that you can see. And it might seem really simple, but this is good because when we are triggered, when we are overwhelmed, when we are flooded with emotional and physiological responses, again, this is not the time to be doing extravagant problem solving. We need to lower the bar. So 5, 4, 3, 2, 1, you can do this exercise anywhere and nobody knows you're doing it. So I might tell a client, pick out 5 things you can see, pick out 4 things you can hear, pick out 3 things you can feel inside your body, 2 things you can reach out and touch, 1 thing you can taste or smell. Or I might do it with colors. Pick out 5 red things, 4 black things, 3 orange things, 2 yellow things, 1 green thing. Or I might do it with squares. 5 square or shapes, 5 squares, 4 rectangles, 3 triangles, 2 figure eights, 1 octagon, or whatever. You know what I'm trying to say. Anyways, these are you can just, that little exercise, you can change it up anyway. Again, it might not be the be all end all, but do this coupled with a bunch of other exercises. I also teach my clients to do breath work. So I teach them to do this deep diaphragmatic breathing. I like to tell my clients, I know other people teach, 4 breath, or count of 4, hold your breath, count of 4 out, 4 in. I don't like to have clients hold their breath. I believe that can be anxiety provoking. I tell my clients to do a rhythmic breath. So slow your breathing down as best you can. I actually have my clients put their cell phone on the floor, start the timer, and try to get up to 4 or 5 seconds of slow 5 seconds out, slow 5 seconds in, and do that for 5 or 10 minutes. Slow, rhythmic breathing, concentrating only on your breathing. Every time a thought pops up, push it aside, redirect your thoughts back to your breath work. So yeah, again, slow and deliberate, rhythmic breathing, and you might notice again at the end that you're maybe 10% better. Do another exercise, another, maybe not necessarily at the same time, but I will also teach my clients, depending on where you are and what you feel your needs are in that particular moment. I have a lot of clients that are highly athletic. I'm highly athletic. For me, exercise is a great coping mechanism most of the time. One thing that, good morning, Kira. Hey, nice to have you here. Another thing that I would teach my clients, for example, if you're really triggered and your heart rate is really high, let's use that, okay? So go find a set of stairs, plow up and down those stairs 5 or 10 times until your heart is, till your heart has a reason to be pounding, we should say. And then when you really want to stop, like when you're exhausted, now you've distracted yourself through using exercise. When your heart rate comes down from the physiological exercise that you've been doing, your thoughts will also, kind of calm down. Your emotions will calm down at the same time. So we can kind of use, in that instance, we can use that physiological response you might be feeling to help, and work with it to calm ourselves down in another way. It's really important. Clients, you all have to, or people, you'll have to figure out what works for you and adapt it to the environment that you're in. For example, if you're out, in nature, I tell my police clients, if you're at an accident scene or something and you're triggered, you need a few minutes before you go engage somewhere else. Let's say you happen to know that there's a parking lot, really close to a waterfall. Well, for goodness sakes, walk out to that waterfall. Let your senses be engaged with the sound of the water, even for 5 minutes if possible, right? And doing some of these exercises, again, you might only feel a 5% relief, but let's say, or 10% or 20%. Let's say you get 5 or 10 or 20% from each exercise. You do 3 or 4 of these, now you're feeling 50% better. And that's enough to help. Another exercise I teach people, do the alphabet. Actually, I don't teach people, but I should. This is on my list. So I was like, do the alphabet, ABCs with people's names or places. Any one of these things can help. Talk to one of your favorite people. It's really important to use our coping mechanisms to investigate what's going on, examine your thoughts, what are you saying to yourself, and is there a better way to be thinking about this? For example, I was working with a client yesterday and he told me that he realized he was really close to the scene where he'd been abused. He drove by, he had a really, really awful bodily response. And 20 years later, he was still beating himself up for having had an awful bodily response. I said to him, I think there's a better way to think about that. I think, perhaps that was, you went into a big T trauma situation without being properly prepared and, without being, he was with other people, so he wasn't emotionally prepared to go back to that spot. It was just sort of a one-off. I worked with another client and we talked about what had happened at that spot many, many times. We did EMDR around what had happened at that spot many, many times. He had been avoiding driving by, but after we did all of those, trauma, after we did intensive therapy, I did tell him to go drive by that scene and to sit there and to allow himself to experience these bodily responses because he was more armed, because he was more equipped. And avoidance was not good for him in that situation. But my point is that we have to be prepared before we go into these really dangerous situations. Even police are well prepared, hopefully when they go into these really dangerous situations. Like, if at all possible, when police officers are going into the really dangerous situations, they will use the emergency response team, who are very well-oiled, well-trained machines. They're well prepared. They know what they're going into. And so the same is true for us. If we know we're going to be going by, a scene where abuse happened or something like that, we need to be emotionally prepared. We need to be able to recognize these bodily responses, predict them, etc., so that we can manage and so that we can cope, so that we can get through these situations without having them crash us or derail us for 20 years, and so that we don't beat ourselves up. Again, like I say, there's better ways to think about things. So when you use these coping skills as a Christian, I also like to, for example, I might be out for a walk in nature. That's one of the things that works for me. I walk my dogs and I'll notice myself having an anxious thought or something. I will do this deep breathing. I'll try to redirect my thoughts. I'll also quote scripture to myself. My favorite scripture is, I'll say, or actually make a demand on God. I'll say, God, you have not given me a spirit of fear. You have given me the love. You have not given me a spirit of fear, but you've given me a sound mind. You've given me a power, a spirit of sound. I put a demand on God. The scripture, 2 Timothy 1:7. I invite the Lord into this situation. Sorry, I'm fumbling the scripture right now. But I ask the Lord, give me peace. Lord, give me a sound mind. Lord, you've not given me a this spirit of fear. I will tell myself those things. I'll put that demand on the Lord. I'll invite him into those situations. I'll ask him to comfort me. I'll invite him into that memory. I'll say, Lord, I need you to come in and heal this memory. And guess what? He will. And the Bible also says we are to set our mind on things of above. So this means, like, if, like, even this morning I'm in the shower and, it came to my mind that somebody said, hey, have you treated your dogs? My brain goes down this, for ticks, because it's tick season, sorry. So my brain quickly goes down this rabbit trail. Oh my gosh, I'm going away. I didn't treat my dogs. All of a sudden I'm imagining Lyme disease and all these terrible things. So I had to redirect my thoughts. I was like, this is crazy thinking. I started thinking about something I'm grateful for instead. I redirected my thoughts. I'm going away for a few days. I'm going hiking with a friend. That's a way nicer thing to be thinking about, right? So I redirect my thoughts. I set my mind on things that are above. I decide to be grateful. I pick something even small to be grateful about. Lord, I'm so thankful that I have clean water coming out of my taps. Lord, I'm so thankful that I have friends. Lord, I'm so thankful that the air is clear. Lord, I'm so thankful there's food in my fridge. These kinds of things, because it's really, you can't be anxious and grateful at the same time. So, takeaway for today, when you have these strong emotional reactions, when you have these strong physiological reactions, be good to yourself. Don't beat yourself up. Don't go into the closet and get that psychological 2x4 and beat yourself up. Be kind to yourself. Practice self-compassion. Set your mind on things up above. Little teaser secret that I teach all my clients: strong emotions typically only last 90 seconds. They come in like a flood, like a wave. They have a peak and then they start to dissipate. So if you can allow yourself to ride that 90 seconds out instead of pushing those emotions aside, attend to your bodily responses, attend to the way you're thinking, and then set your mind on things up above, attend to, those coping mechanisms that work. If we can incorporate all of those things at once, we can manage our triggers. We can be better equipped. We can be prepared when we know we're going to have to go into those situations. We don't have to be derailed when we get triggered. So I hope this was helpful. Next week, I want to have a little bit of fun next week. Next week, I'm going to teach you how to stop a nagging spouse. So if you have a spouse that's always nagging at you, that just doesn't seem to stop talking about the same subject for a lot, and you just tune them out, whether you're male or female, tune in for next week. This is what I'm going to be talking about. Hopefully you'll be able to, hopefully today was helpful. Hopefully next week's going to be helpful. And anyways, that's all for today. Goodbye. God bless. Have a good rest of the week.